I am now washing my hands for 30 seconds. Washing your hands is the best way to help prevent the spread of bacterial and viruses that can cause disease. I'm gonna for my hand. Hi, my name is Genesis Camargo. I will be your registered nurse today. I will be performing a physical assessment that will approximately take anywhere from 10 to 15 minutes. I will be asking you a series of questions. All information will remain confidential. Is that okay with you?
Yes.
Great. I will now be assessing your mental status. Can you tell me your name and your date of birth?
Alex Hernandez, August 11th, 1994.
Do you know where you are right now?
Hospital.
Can you tell me the year?
2022.
Great. Patient is alert and oriented ×4. Facial expression is relaxed. Speech is clear and fluent and appropriate for age. His affect is appropriate and his mood is normal. Patient is cooperative for evaluation and his memory is intact. I will now be checking your vital signs. Put your finger here and your temperature. Wonderful. Your blood pressure is 120/80. Respirations are 16. Heart rate is 60. Temperature 98.0. And SpO2 is 99 on room air. Vital signs are within normal limits. We'll now be assessing your pain. Are you hurting anywhere?
Yes.
Where?
Left arm.
When did this start?
Last night.
How long did it start? How long has it lasted?
Throughout the whole night.
Can you describe the pain?
Achiness.
Okay. Does anything make it better or worse?
It's worse when I move it.
Okay. Are you currently taking anything?
Tylenol.
And how often?
Every 6 hours.
Okay. Okay. All right. I will now be assessing your head and your scalp. Skull is symmetrical, scalp is pink and intact, color of hair is evenly distributed. I will now be looking at your face. Eyes are symmetrical, nose is midline, eyebrows are symmetrical as well. I will be assessing your cranial nerve, which is your facial nerve. So I'm going to have you close your eyes, both of your eyes, and smile. Brown. Puff out your cheeks. Great. No facial drooping. Facial expressions are symmetrical. Now that we've done that, I'm going to have you open your eyes and we're going to check your trigeminal nerve. So for this, I'm going to have you bite down and I'm going to feel your masseter in your temporal muscle. Bite down, please. Perfect. I'm going to try to open your mouth against some resistance, but go ahead and bite down. Great. Your trigeminal nerve is intact. I'm now going to look at your eyes. For this assessment, I'm going to have you stand up, and we have a stand up. And we have a Snellen board right in front of us. We're 20 feet from it. I'm going to have you, with this card, cover one of your eyes and go ahead and read me what you can.
D-E-F-P-O-T-E-C.
Wonderful. Next eye. Read it.
D-E-F-P-O-T-E-C.
Wonderful. So my patient read line 8, which indicates that he has 20/20 vision. Okay, I'm going to have you sit down. Now I will be assessing your ocular motor nerve, tracheal, and your abductus nerve. I'm going to have you with my pen light. It's going to be at about 12 to 14 inches from you, and I'm going to check 6 cardinal fields of the haze. So I'm going to start at the midline and try not to move your head and just follow my pen light. Okay, wonderful. Go ahead and continue to look straight. I'm going to dim the lights and I'm going to check for reactivity. So look straight. Great. Now I'm going to turn the lights back on and I'm going to check for accommodation. So just look straight ahead. Follow my pen light, please. Great. There is no nystagmus. Pupils are equal, round, and reactive to light and accommodation. What I did with my otoscope is I checked for the size, color, and cuspis ratios of the eyes and the margins as well. Moving along, I'm going to look at your ears with my otoscope. I'm going to check your cranial nerve 8, vestibular conchoidal nerve. What I'm going to do is I'm going to have you cover one of your ears, and I'm going to whisper 2 words. Apple, banana.
Apple, banana.
Wonderful. When I come to the next side, cover. Cat, dog.
Cat, dog.
Wonderful. All right. With my otoscope, I'm going to be looking at your ear. I will be looking at the external auditory canal, tympanic membrane, and I'm going to raise up the pinna and down. Pull pinna up and back, look inside. Tympanic membrane is a clear, gray, and shiny. I'm going to feel it around. Any pain?
No.
Great. Ears are symmetrical. Tip of the ear is the same level as the palpable fissure. Skin is warm and intact and uniform in color. No drainage or lesions on the ear. Now I will be looking at your nose. Okay. I'm going to be checking the cranial nerve 1, the olfactory. I'm going to have you cover one nostril and breathe in. Next one. Wonderful. Any difficulties?
No.
Okay, great. I'm going to have you close your eyes and I'm going to have you smell this candle and tell me what scent it is.
Vanilla.
Great. Perfect. Okay. I'm going to palpate your frontal and maxillary sinuses for any tenderness. Sorry, maxillary and frontal. Any tenderness?
No.
Nose is midline on the face without deviation. Cranial nerve 1 is intact. No frontal or maxillary sinuses tenderness. All right, moving along, I'm going to look at your mouth. I have gloves at this moment that I've changed. Open your mouth. Let me look at your palate. Under your tongue. Wonderful. Great. I'm going to be assessing your glossopharyngeal and your vagus nerve. So go ahead and open your mouth and say ah. Great. Any swallowing difficulties through any of these exams?
No.
Great. I'm going to assess your hypoglossal nerve. So I'm going to have you open your mouth again and stick out your tongue and move your tongue from side to side. Great. Uvula is midline and rises and falls midline. Tongue is pink and moist midline. Saliva is present. Lips are pink and moist without any lesions and symmetrical. Mucosa uniform pink without any lesions. Pink. Teeth are white without any devices. And palate was white. Tonsils are present and pink without any swelling. Okay, I will now be looking at your neck. I'm going to be assessing your cranial nerve, accessory nerve, I apologize. I'm going to have you move your head from side to side, up and down. Wonderful, great. Okay. I'm going to have you shrug your shoulders, and I'm going to put some resistance. Great. Now I'm going to feel periarticular, postarticular, occipital, carotid, jugular disgastric, submandibular, submental, superficial cervical, deep cervical, posterior clavicle, supraclavicle. Great, no tenderness?
No.
Wonderful. I am now going to be feeling your carotid pulses, one at a time. Carotid pulses are strong 2+. I will now take a listen. So for this, I'm going to have you breathe in and breathe out and hold your breath. Breathe in, out, hold your breath. Breathe in, breathe out, hold your breath. Wonderful. Pulses are regular, rhythm, and no bruit. Now I'm going to take this time and I'm going to listen to your lungs. While listening, before listening, I'm going to inspect his skin around the thoracic and the back and the posterior. I'm going to inspect the interior and posterior diameter, which is within normal limits for him. And now I'm going to listen to the lung sounds. Breathe in, breathe out, and out. Wonderful. Okay, I'm going to do this to the back now. Wonderful. You're doing a great job. Wonderful. You did a great job. Any difficulties while we were doing that exam?
No.
All right. Good deal. Okay, you're doing great. We're almost done. Okay, I'm just looking at your back. Vesicular breath sounds are equal bilaterally. Lungs are clear with no adventitious sounds. Skin on the chest is anterior and posterior is symmetrical, intact, warm, and pink. Skin turgor, intact. At this moment, I'm going to be assessing the breast on my patient. What I will be doing is I will be making sure that the skin is consistent with the rest of the body, that there is no vascularity. When assessing the areola, I'm going to check for symmetry. I'm going to palpate for any masses, and I'm also going to check for any nipple discharge at this time. My patient has none. Next, I'm going to palpate the axillary lymph nodes. I'm going to have you raise one of your arms. Sorry. You let me know if there's any tenderness. I'll be palpating the lateral, the central, the posterior, and the anterior as well. Wonderful. You let me know if there's any tenderness. Wonderful. Any tenderness?
No.
Okay, great. For this assessment, I'm actually going to be looking at your skin as a whole. So your nails as well. So I'm just going to look for any abnormalities. Looking at skin turgor. My patient's skin is warm, dry, and intact, no lesions. Pulses are +2 bilaterally. Looking at your nails. Wonderful. Capillary refill is less than 2 seconds. When I looked at his nails were convexed, trimmed, translucent, and no clubbing was present. I'm going to look at the palm of your hands. And turgor intact. I'm also going to look at his toenails and the lower extremity skin. Nails are clear and translucent, no clubbing. Nails are less than 30 seconds, capillary refill. Do you have any questions for me today?
No.
Okay, wonderful. Thank you.